Welcome to The Dentist Show. Let's jump right in.
Welcome to The Dentist Show.
The Dentist Show?
How are we The Dentist Show?
Well, you're a dentist. I'm a dentist.
But you think like
This
there's
is
some other dentists that would have been cooler to be The Dentist Show, and here we're making it happen. We're here.
no one's cooler than you, man. No one, except for me.
I'm Viking. We've already established that.
Yeah. I think the reason that we're the Dentist Show and no one else is because we picked the Dentist Show as our title before anyone else did.
I think it picked us.
Maybe that's it.
The Dentist Show picked us. We probably discussed this already, but we were the Dentistry Sucks Show.
We were. And then we were going to do like a suction noise like,
We did 15 times.
yeah.
We decided we didn't want to be as annoying as that one podcast with the drill.
I don't know what you're talking about.
Dentrepreneur.
Dentalpreneur.
Chris Costas.
Mark
Costas. That makes way more sense. Chris. Mark. I missed the Dental Hacks show.
Here comes our 1-star review from our competitor.
I missed Dental Hacks show. I think that's what our show probably most closely resembles was the old Dental Hacks show.
Yeah. Is that Howard Moran?
No, not at all. No. It was Jason Lipscomb. Oh my gosh, where did I pull that out of? And his co-host. So I don't remember his name. But that was a great show. They ended it. I think they broke up, and that was it. I think the other guy. You never watched it?
I don't think I ever listened to it.
Yeah. Well, there's been a couple, but so there's a funny story we were talking about this morning.
Yeah.
Was our amazing front office team member said we should share that on the podcast. We're going to share it.
Oh, I can't wait because I don't remember.
Bad memory.
Yeah.
Because she thought she didn't even know you were the co-host.
Oh, yeah. Actually, that was funny. Very sweet gal. Very awesome
great.
that she did some recording for us. And it was funny that it took her at least 40.
Yeah, almost an hour.
Yeah, almost an hour. And then like while we were recording and it had to be silent, she like looked up at me and she's like, "You're Dr. Bushman?"
Yeah, because I think I introduced you guys as Ryan. This is Alexis is Ryan.
Yeah.
So she probably didn't piece it together.
Yeah, it was
she
just
probably
so
thought you were a
funny.
patient.
And she just started laughing at herself because she's like,
"Whoops." What were we talking about? We were talking about undescended testicles in dogs.
yes, we did start out that day.
So that was
about,
that's where it started this morning, and
Yeah.
I want to bring it back up because my little dog, his name was Boxer, and he was a Shih Tzu. He was not a boxer, but when he was a puppy, he had black eyes.
so he looked like a boxer.
Yeah, it looked like he's been punched and was a boxer.
He did, right in the testes.
Yeah, right. The one test. He had an undescended testicle, and I remember I don't know why we even brought this up, but we were so poor because we got him when we were in dental school. At that time, our first year of dental school, I was going to be an oral surgeon. Mm-hmm. So I would study with my friends till 10 p.m. o'clock. 10 p.m. at
10 p.m. o'clock.
10 p.m. o'clock. 10
Just 9 or 10
at
p.m.
night. And with my friends, I'd get home, wake up at like 6 or 7, would go back to school. So I wouldn't see my wife all day.
Yeah.
And so I thought I'd be a good husband and buy a dog, even though she had no interest at the time on a dog. And we found Boxer. And so we thought, man, maybe she would bark if someone's at the door. So I moved her away from her family and everything to go to school.
Yeah,
and
have a
just
little ankle biter to protect her.
Yeah, that was the goal. But then we were so poor, we couldn't fix him. We couldn't do anything. Like he got sick or anything. It's just like, well, I hope he doesn't die because we have no money. And so he had an undescended testicle, and you could like feel it in his little belly and like flick it a little bit.
Were you flicking your dog's
It was like in the stomach one. He didn't care, It's just kind of like a weird little thing. We're always pressured to get the thing cut out. I felt bad because they kept saying, your dog's going to get cancer if you don't get this removed. And I was like, I feel bad, and I do not have $300 to get this thing removed. I'm sorry, I'm a bad dog parent. But we felt so guilty. He did end up passing. But he was like 13 years old, and he never died of cancer. That was my undescended dog testicle story.
Like, Where did this fit in this episode? That's how we started our day.
Well, that's how we started today.
And then Alexis finally realized that I wasn't just some guy that laughed at undescended testicle jokes.
Well, that was my story. So what do you want to talk about today? No, so the conversation was going. I don't know where it was going today. I don't know why it even got brought up. We were talking about dogs, and he was a better dog than our current dog.
Yeah, Rusty's.
And we're talking about your dog's barking and kind of a free loner or a loner. Or
Sunny just likes to go roam and play on the land by herself and bark at deer.
I want a little bigger dog, so we got a cockapoo, and Raquel loves him. And he's great, and he tends to bark. He's getting better now. Before, like even 6 months ago, he wouldn't just stop barking at people that come to their house.
I mean, today Rusty, who knows me,
still
wouldn't
barks.
stop barking at me.
Yeah, he only did it for a little bit.
Yeah, that's true. He did eventually stop. Yeah,
so he's improving, and I just love our old dog compared to him. And it offends Raquel when I say that. So I was getting to is we had this old veterinarian in Ohio.
Okay,
and our dog wouldn't stop throwing up. And this veterinarian was so cool, so nice. I think he probably knew we had no money to bring him in. Yeah. I think we called him, and he said, try this. And didn't. No, I think we went in, and he said he had some medication. I think it cost some money. Like, we can't pay for it. And so he said, just give him some hamburger and rice. Just cook up some hamburger and rice.
Oh, yeah. I think you did tell me something like
this. And we did it, and it stopped. He stopped throwing up immediately. He never threw up again. And we were talking 2 or 3 days of throwing up. And he said he probably ate some, rabbit poop or dog poop that was in our yard or something. Or grass or something. Because he kept eating grass and throwing it all up. And so I look back and think, okay, that guy, obviously, I think he charged us $20 for the visit. That's what it probably was. And it was like a handwritten receipt thing.
Yeah.
And he came up with a therapy that cost us no money. He got paid no extra money for it. And I guess where I was going with today's topic was, can you even find that anymore?
Yeah.
Does that exist? Because I feel like anywhere I go, and even when we train our teams too, it's like, how can we maximize the spend of the person walking through the door?
Yeah.
And we tailor it to let's fix their problem by getting to know what they need most. Mm-hmm. And then we have all these tools to sell them. Where I think 20 years ago, it was, we have all these tools, let's give it to them so they avoid coming here. And I feel like it's almost, I think we do a really good job only recommending things we could see them improve with. But I feel like we're building a home now, and it's any minute they can nickel and dime you or charge you more. They're going to do it.
They just go for it.
Oh, you want to upgrade that? Let's upgrade it. Let's do this. Or where was I the other day where I was kidding me? Oh, flying on an airplane. You just can't. You used to pick a seat.
And that was your seat.
And then it was oh, you want to send the extra row? Now we charge more for the extra row. I get that. But now if I want to make sure I sit by my wife, that plane's going to cost me at least $100 more each way. And then if I want to sit by my kids and my wife's, all 5 of us in the little group, that's going to cost me $200 to $300 more to make sure it happens. So it seems like every business we do or we use are going to try to maximize your spend and just I know you guys paid $300-$400 each for that flight, so a family of 5 is a couple grand.
Yeah,
we're going to try to suck another $20-$30 out of each person. To sit by each other. I miss that veterinarian so much, and I think sometimes that's when people come to me deep inside. That's who I want to be.
Yeah,
and I still have hygienists that want $100 an hour. I have dental assistants that want $50 an hour. I have other doctors that want to make so much money. So there is stress to feed everybody around me. And I'm man, that veterinarian had one assistant and front office person.
Yeah.
So she was dual trained. And so he went and did surgeries. She was there and would answer the phones. I'm what a simple, cool life.
Yeah.
Can that business model exist?
Well, I think the business model can exist.
But would it go out of business?
The lifestyle of the provider would look potentially different than some of our providers and maybe our lifestyle if you wanted it to succeed.
I think you'd have to be a dentist. I think you'd have to charge a lot.
Yeah.
Or you charge the large fee and everything's included. So say like,
Yeah.
I'm going to charge you. So our typical prophy fee is like $90, let's say. A reimbursement's not that from insurance, but I think a reimbursement's like $60. So we'll say, okay, well, I'm going to charge you $200 per all your prophy, and I'm going to give you every tool you need. Like I'm going to give you a toothbrush, I'm going to give you fluoride, I'm going to give you whatever, and it's all included because you gave me a big fee versus trying to like, okay, we only got $60. We're going to try to get $200 an hour, so we're going to like start selling these different products. Or you have like one chair in this little tiny weird office that's really creepy.
That's what I'm saying. Is
to keep your
like,
overhead really low.
Yeah.
And
you do everything.
And you do everything. Actually, one of my fellow dental school graduates' dad was a dentist, and he answered the phones. He had a part-time dental assistant, but he would be there all by himself, which is so crazy. But he would stop mid-treatment, answer the phones with his gloves on, like, hey, this is Pax, beep, dental, how could I help you? And he would take down notes. He would do his own suctioning and stuff. But he was a one-man show. And sometimes that seems so simple.
Yeah.
And super stressful too.
Yeah.
So,
well, I think there's a healthy balance. And I think in today's world, we see, I guess maybe not in today's world. I think you and I like to see a system be as efficient as possible with our time input, with our team's time input, and with our patient's time input. So if you're already here, like I'm here, you're here, let's do it, right? And so if I'm here and I'm the dentist, legally I can do certain tasks that no one else can. And then there's someone that can legally answer the phone that's not me.
yeah.
So then why am I stepping away from my task that I can legally do and no one else can to go answer a phone that I can hire someone to do? And then legally speaking, there's assistants out there that can do their thing and they can't do what I do. So then how can they help me get more efficient with my time? And then all of a sudden we just snowball this thing and it's like, okay, I can run 3 chairs if we have an assistant in each chair plus someone answering the phones. And
then we have 100 team members.
Yeah.
And 8 locations.
Yeah. And it just keeps going.
And then we look back and like, remember the good old days?
Yeah.
It's just me and 2 people in the office.
Okay, but I mean, I do reminisce on that from time to time because I remember, we were in the old Spokane Family Dental office. There was 5 chairs.
Oh, yeah. Yeah. We
2 hygienists.
remember staying late and painting the office.
Yeah. You do a hard day's work of dentistry and then paint the office, right?
Trying to brighten up the place.
I don't remember it being necessarily less stressful then than it is today. I think everything was just so new that it was maybe more enjoyable. Right? Now it's like, I feel like to a certain extent we're doing the same thing over and over again in just a higher volume.
Yeah, I think I agree. And I think the other way to look at it too is, that guy, in our mind, he provides such a service.
Yeah.
And at this point, I don't know if I'd go to him, because his hours probably hard to get into because he was a one-man show, or he maybe didn't offer all treatments or something. So the other side of the story, he was doing it, and he's probably like 80 years old. So it wasn't all about the money. It's just more of like he liked what he did. And how I look at it too, because I think there is, not necessarily any more or less stress, and there might be. Look how many team members we get to help influence.
Yeah.
And then those team members get to influence patients to do better things and cooler things. And so I think that helps me sell me on the fact that this is a good thing. Sometimes when I look back, I'm like, man, that guy was amazing.
You're just gaslighting yourself
into just believing. Yeah. So I think we can get to that business model in the sense we felt like he over delivered.
Yeah.
And I think that's the key. That's the secret, is always offering more in service value than they pay in dollars. And when you do that, the patients leave here feeling the same way we felt. Like, what a crazy thing that probably some vets didn't know how to fix or just want to push some medication to sell us.
Yeah.
And this guy's like, oh yeah, you just mix up some rice and hamburger, cook it together, and that will solve the problem. And it was the perfect fix. And so it's like a memory we'll always keep with us, because we were so scared and poor, and some was so simple that
Yeah.
that helped us through it. So he over delivered for what we paid him. And he even called us the next day to see how Boxer was doing.
Wow.
Yeah, he's a neat
Nice
dude.
guy.
Yeah.
He's a real homeboy.
He was the OG,
Yeah.
like the customer care. And
Yeah, that's awesome.
so I think you can do that. I think you're a long ways from doing that. But you can do it.
I think there is a hybrid way to do both. Ensure we have that high quality customer service, that we're caring for our patients, giving them more in service than what they give us in dollars, like you said. And I still do believe that we truly provide an amazing service to our team, our patients, and our community at large by helping people with these teeth,
Yeah.
right? The teeth is not the why, it's the what. The why is because these teeth are attached to people, that are attached to families, that are attached to communities, and our patients are attached to so many people outside of here, and our team members are attached to this community. They're attached to their families, right? And so how do we positively affect the team? How do we positively affect our patients? Ultimately, by providing great services, helping them get out of here so they can focus on what matters most to them.
Yeah, and that's our brand identity is, and what we're known for is making smiles about more than teeth. And that's the goal. I think that's the goal of like that guy's veterinarian practice, is how we want to be to every patient.
Yeah.
And we are not just pushing product, or you're not just buying a seat on our airplane and then we're charging you for, like Allegiant is like, you pay for your ticket, you pay for your seat, you pay for your bag, you pay for your Coke, you pay for your cookie. Like they're nonstop nickel and diming.
And then when there's problems with the plane, you have to
Yeah.
get off that plane and get on another one.
Well, in Allegiant, you got to wait a day or two to get on the next plane.
Yeah.
But that's what we're trying to avoid that, and we're trying to maximize the profit, not just to make more money, but also to help more team members and elevate them so they can come in. And say if you take someone that has a very limited mindset or skill set, and you're able to grow them into a person who's now not only a leader to a practice, but a leader to their community, a leader to their kids or their family, and sometimes even a leader to their parents, of how much more impact would they have in this world because you help these team members learn and discover who they are. That's way cooler than, and there's nothing wrong with a one-man show, but that's pretty cool to have that effect on so many people's lives, to have that ability to take the risk, take some extra profits that you've made and investing it in your team to help grow them so they can have the same experience and memories that you're creating.
Yeah, and that's one of our core values is experience first.
Experience first. Experience is first.
Yeah.
That's right. And if someday this all ends, I'm going to have a small practice, and I think it's just going to be me and maybe 2 people.
And 2 dogs.
No way. 1 dog. 1 dog, and it's going to be a large dog.
It's not going to be a Shih Tzu with a...
No, I want a large dog with our boxer mentality, not necessarily a Shih Tzu, but our dog was just chill. He'd come and welcome everybody.
Yeah.
That's what I want, like a big white lab. Raquel agrees 100%. No, she doesn't want a white lab at all. And he just lives at the office. He goes, you get out of the car, he jumps out of the car with you, he goes into work, he greets all the employees.
Yeah.
And every patient that comes in, and you get to select the people that you want to work with.
Yeah.
It's like, oh, do you like dogs? No, we're not the practice for you. Because we have one that's going to say hi as soon as you walk through the door. So you get to select the patients you work on, and that's going to keep your practice smaller because you're not going to see everybody. I think I just hit the jackpot. If this ever ends,
it's so funny how that is what you see as ideal. If you when you're done with it all, you have basically just created my nightmare.
Having a dog in the office?
I would absolutely. Okay, I'm a nice person.
So you wouldn't.
I don't like.
So you wouldn't be my patient.
I wouldn't like to. I don't go out to harm animals. And if I was laying in a chair and some wet nose touched my hand, I'd be like, "What the?"
Well, he's just going to come in when you're scared. And so if you get touched, it means you're a little pansy.
That's what you said to me earlier. And I still don't want the wet nose on me.
He's there to calm you. I think it'd be amazing. I don't know how I would feel if I was a patient walking in. I didn't know it was going to be a dog coming in at me. Yeah. And I don't think I'd care that
if they turned around and walked out, then they weren't for you.
Yeah, it'd be like, God, I didn't get that person.
Yeah,
because I know what party they belong to.
Yeah, see, I'm thinking more of we're like a natural dental office, as in just you either are nude there or you don't get to come in.
You're nude?
Yeah, like a nudist colony for dentistry.
One of my
I'm just joking.
One of my coworkers when I was first a dentist. Doctor, I forget his name, but he moved to California. We were both associates, and he said he was dreaming up the idea of having like a swimsuit dental office.
Oh, like the assistants were all in swimsuits, and the doctor was like in swimsuit.
Yeah. Well, the doctor would not be.
Oh, okay.
But like the assistants would be like the coffee shops that do that.
Yeah.
That was his idea, and he's like, "We're just gonna take it to Vegas, man. Let's do this. It's gonna be amazing." I'm like, I just feel like that's like not appropriate.
Yeah,
I think the board might come shut you down. The assistants,
even if they had like a clear apron on, like I can't say who would, because I'm sure that there would be a.
You said you wanted them nude.
Yeah, that's different
than wearing a swimsuit.
I would not want to go to a dentist where there's a bunch of nude people. Oh, your mouth is open. You're out there, and you didn't get to choose what nude people were in there.
Where is this going? I think you should stop right now.
Okay. And I don't think that I would have trust in an office that was just swimsuit people. People in swimsuits.
They can make people's coffees and go to the beach, but not do dentistry.
I don't think people that wear two-piece swimsuits are bad. That's not what I'm trying to say by any means. I just don't think that the dental office is the proper setting.
Well, sometimes in the summertime, we do get patients that are practically wearing swimsuits.
Oh, yeah.
So, that goes that. And so we're not going to do that, but we will do the dog idea.
That's what the bib's for.
Is that I think we made agreement that next practice is going to be a dog practice.
Yeah.
And I'll work
Which
there.
Dogs are nude?
Dogs are always nude.
Yeah.
And that's going to be okay. And I think there are a couple places in Scottsdale does that. I think it's a cool idea.
Yeah. I know of an office up where we're at that
does it
they've got two.
See, that's a little much.
Two little golden doodles. And
golden doodles are not little.
Yeah, you can get miniature golden doodles.
Yeah.
Sonny's, my dog Sonny is about the same size as your dog, and she's a golden doodle.
Yeah, he's a mini. I thought we had to clarify because golden doodle's like big.
Yeah.
So mini. Yeah. I think I want a big dog.
Let's just be clear. I don't want a natural nudist dental office, and
you went there.
Bikinis are probably not the proper attire for a dental chair, and dogs can be your heaven.
Dogs can be. I think it's be cool because I think that gets to choose your patient base that way.
I think it for many people it takes the edge off to have a dog in the office, and they can come for you, and
it's fun. Something to talk about.
I'm happy for people that want that.
Because the other core value is what we talked about. Experiences first was supposed to be like we're making memories, creating memories with patients. And if you have a dog in the office, how many patients are they going to tell friends about that dog in the office? Either good or bad.
Yeah.
You're going to be taught. It's like Trump. He got elected because he's good and bad.
Yeah.
But he's always being
people
talked
can't
about.
stop talking about him.
Yeah. So everybody knows who he is because he's always in the media.
Yeah. So
dogs. And I don't think you'd see a dentist having a cat because nobody likes cats.
I don't think that's true.
That's not true.
I think there's a whole group of people that like cats.
Yeah, but they like who wants a cat? And they're not caring.
I get what you're saying.
They're very judgmental.
People don't want cats in the dental office.
No,
you're not saying people that have cats are.
Kind of.
Oh yeah.
Just kidding. I have a couple doctors have cats, but
I was gonna say.
They would be cooler if they had dogs.
You heard it from Chase. He's not a cat guy. All about the dogs.
We had a patient that had like 9 cats, and she was like this crazy cat lady, and they started dying off because of old age, but she committed not to replace them because anyways, she has no cats now.
Oh,
I swear she's a little more normal.
Yeah. What's the toxoplasmosis? You remember you're learning about that?
No, the cat herpes.
Yeah, it gets in your brain, and then your brain like walls off around it. Do you know what I'm talking about?
Oh, there's a whole nother thing going on called cat herpes. Have you heard about that?
No, tell me more.
So there's a thing called internal resorption for the non-dentist. That's when your body's more or less has an inflammatory process and starts eating away the roots of the teeth.
Is that caused by cat herpes?
That's like
the newest
correlation.
Whoa.
Yeah. So ask a patient next time. I
Next
tell all
time,
doctors,
internal resorption.
say, do you have cats?
We're gonna start our own data.
Do it. And that I am 2 for 2.
What?
Yeah. 2 for 2 lower anterior teeth or internal resorption. And I went to somewhere course or something. They talked about it, kind of laughing about it.
Yeah.
And I think someone said that. I've asked like 3 patients, they all have it. I'm 2 for 2.
Wow.
What's the chances of that? They both have cats.
Yeah.
And so I don't say anything. It's not like I don't want to like scare them. Like, hey, you have cat herpes.
So
but in my mind, I'm just thinking like, oh, cool, you have cats? Yeah, I do actually. Why? I'm like, oh, I was just wondering. Yeah. So this is just about your body, just absorption. Let's do this, and this.
Maybe it's a genetic predisposition to liking cats that is the problem, not actually the cats.
Not the cat herpes.
Not the cats. Okay. So hey, before we wrap this up though, I do want to wrap up toxoplasmosis real quick.
Oh yeah, you can wrap about that.
Okay,
That sounds way more boring.
Yeah,
than
yeah.
cat herpes. We should probably ended it.
So in cat feces, people that like empty the bins and stuff, they get toxoplasmosis in it finds itself in the brain, and it's a virus that your body then walls around it, so it creates a little cyst, like probably microscopic. I can't remember size, but a little cyst. Therefore, a void in your brain tissue. And people that own cats have multiple of these voids in their brain, right? This is also the reason they don't want pregnant women to have cats around them or handle the cat litter, right?
Mm.
Does the crazy cat person buy the cats, or does the cat own the crazy cat person?
Wow,
right?
That was interesting.
The crazy cat person is created by the cats.
Okay.
Yeah, that's my theory.
That's your theory.
Yeah.
No one likes cats.
Yeah.
They're cats. They're
Yeah,
wild.
Yeah, we're gonna regret this. Someone's gonna put like a bunch of 1 stars.
Guarantee we get one.
We don't
That's all
dislike people that like cats. We just don't like cats.
No. Yeah, and you get cat herpes and histoplasmosis.
Toxoplasmosis.
Yeah, I was gonna say that doesn't make sense. Yeah, so don't do cats. Get dogs, and we'll all have dental offices with dogs soon, and you'll be a patient here.
And we will end internal resorption today.
That's right.
We're starting the movement.
So, be like the old guy.
Yeah. What was this episode about again?
Be like the old guy, the old veterinarian. That's amazing, and affect as many lives as you can.
Yeah,
improve them, and that might be one person, and you just dive into that person and love them and create, and let them see who they are, and affect as many people as you can for the better. And I think it's good too. And that veterinarian obviously touched our lives.
Yeah,
and I'm sure he touched a lot of others. So that's cool too. And I think it's all good. It's all really good.
Yeah, it's be the good in the world.
Yeah, and we forgot to say this in the front of the show again, but share this episode to people that love cats so they can leave us 1-star reviews. And if you like dogs, leave us a 5-star review.
All right.
I probably shouldn't leave that. Just leave it.
You know what? Just
share us.
Just share us, like us, subscribe, do all those things. And
gonna
if you
get
do give us a 1-star review, I really want to know why. Make sure there's a description.
I don't think I want to. It's gonna be like some
I want to know why.
Person hater.
Yeah, that's okay. Then at least I know I'm good. Yeah.
Yeah, share us so we can get some cool guests on. And if you want to see anyone, we'll do our best.
Yeah.
I mean, Joe Rogan's reached out a few times. I kind of denied him right now.
Yeah. I mean,
so
he's not quite big. He's not quite big enough for us yet. So
no, cool.
Once he gets bigger, though, we might let him on.
Yeah, try to get some guests. We'll get some people on so you don't get bored of just us two. And we'll try to entertain you as you're driving to work or working out. So until next time, thanks, guys.
Thank you.
Thanks for listening to The Dentist Show. We hope that this episode helped you make smiles about more than teeth. To get more resources to grow as a dentist and to learn more about Chase and Ryan, go to thedentistShow.com or just follow the link in the show notes. If you enjoyed this episode, share with another dentist in your life and help us grow the movement. And be sure to rate and review wherever you're listening.